Gerald, as you know, I've been using StemWave like really well for so many years. And I'm the one who spoke to you first about StemWave. What were your thoughts? Like when you were, when you wanted, the company's like, well, have you talked to one of our clinical advisors and learn a little about the technology? I'm a sports chiro, but I'm not a medical doctor in the medical field. You do incredible work on the regenerative side already. Obviously, you're super intelligent and whatnot. Before we had that first phone call, what were you thinking about the device and speaking with me and everything else?
So obviously, I'm thinking, oh, here we go, another device. They're gonna try and pitch me. They're gonna try and give me, sell me a bill of goods that ends up being crap. So obviously, I went into it with kind of a negative mindset because I'm like, yeah, this ain't gonna work. So, but a part of me was still kind of hopeful that this could be something that could actually help clients. So, like I said, showed up to the call. I mean, and you were pretty matter of factual. You asked me what I was doing. Where did I start? Why would I want to add this to my practice? And I mean, we kind of had a really good, frank conversation. I know I asked questions that were pretty straightforward, because I don't mince words. I want to make sure that if I'm going to invest in something, it's going to be worth people's.
I love the science side of it. You know that, and you were asking a lot of science-based questions. I don't know if we ever touched on like what other like shockwave like devices you were looking at, or was it only?
So there are a couple on the market, and I was looking at them and reached out to the salespeople for the other company, and then it just didn't feel very warm and fuzzy. Like I got the same kind of feels as I did for every other device that I bought for my practice, and we've, oh God, in my decade we've bought over $500,000 worth of devices. And it's and that's the thing.
Large amount of cash.
That's that you definitely.
I mean, you could have just handed that over to me or something instead of wasting it on all that other fancy equipment, right?
You got jokes.
Yeah.
Which would have been actually a better investment,
Yeah, it would have been a better investment. It's going to be one time, and it just would have gone the front.
It would have been a better investment, but like just being able to talk to someone clinical who actually understood the science and was able to give me those answers. Because I mean, let's face it. A patient's not going to come to me and ask me the same kind of questions I asked you. But the way I approach it is if I understand down to the cellular level how something works, then the application of my brain goes on like, okay, where can I use this? And if you understand the pathophysiology of disease and you can see, okay, this is an issue that's honestly being led by inflammation in the joint, we can apply this new modality on top of what I'm doing already. So for me, it was, after having a conversation with you, then that kind of pushed me a little bit more towards getting it. And I ain't gonna lie, what really pushed me over the edge was the way it was packaged, meaning try it for 60 days. No other, as far as I know, there's no other device company I have worked with that gives you that option. Maybe I'm wrong, maybe there's more out now, but even now I'm still hearing other device companies calling my office to get in. No one starts off with that. And I think that is a true testament to how much the StemWave, employees and the founders, how much they back their product. I like that. If you're willing to back your product and say, hey, listen, dude, try it for 2 months. If you don't like it, we will take it back from you. I'm like, a little infomercially, but you know what? What's the great thing about it is that the device works.
It does. And
the technology works.
You have to run. I mean, your wife practices with you as well. She's also a medical expert.
Yeah.
You guys, is a pretty powerful combination right there. Did she have a say in it initially, or was it just like you're driving, you're like, I want this, honey, I'm getting it, or she's like, you've already spent $500,000 of our dollars. We have kids. I'm kicking you out of the house, or was it more so, this is the last device you ever buy. You better make it count.
So more the latter one.
Okay.
But what's funny is, so my wife, she is the business mind in our conglomerate, that I have to call it. So she's the one that makes the financial decision in terms of kind of, okay. I'm the headstrong. Let's get it now.
Yeah.
So for her, it was
like a kid in a
literally
operator.
So before I brought it to her, and that's why I had the call with you. I was like, let me talk to someone else. I think I spoke to my the client sales rep I had like 2 or 3 times, because I would ask the same questions and it always went back to, so dude, if I don't like this thing, can I just give it back to you? No questions asked. He's like,
You didn't believe it, right?
I
Because they're gonna be like,
no,
I'm gonna hold it for 60 days. What we didn't see in this fine print is for every 3 days you have it, it's $600. We're not charging you for
exactly.
now when you had it.
Exactly. And it's so funny. So I got all that ready, and I'm okay, good. So I put it together. I'm like, okay, the price point for the device really wasn't that bad compared to what I've blown in the past. And I was like, you know what? Let me present to her. So I remember going to her, hey, sweetie, so let me ask you a question. So there's this device, and
She's
it
like,
helps with this. Of course, she went from a smile. She went from a smile to a
You can't
scowl.
say another device. You just say, I have a special device.
I said,
I have a unique technology.
I said, and I followed up with, can you believe they're willing to give it to us for 60 days to try, and then we can just throw that crap back if you don't like it?
6 years.
It's 60 days. 60 days. 60 days.
They heard 6 years. I'm like, oh my god, that's a really long.
That'd be awesome.
Wow.
And then she was like, wait, what? Are you sure about that? I'm like, I asked 3 different people, and they all gave me the same stuff. They're sending over the contract right now. I said, we have nothing to lose. We take it for 60 days. I test it out. If it's pure garbage, we just give it back. And then she's like, okay, let me think about it. So it took her a couple of days.
You didn't have to put your kids down as collateral.
No, thank God. Yeah. Thank God. I got boys. Nobody really wants that. And they're teenagers, and they're smelly.
They're probably pretty cool.
They're smelly.
So let me ask you this one then. So you get the device, you finally get it.
Yeah.
You're wetting it through. The wife's like on you on this. Like, if you look, we've already wasted this much money on stuff. This one better really work. You bring it in the office.
Yeah.
In this big box. Comes like so well protected. I could swear like the thing's like Armageddon proof.
It was.
You can't open this thing. It's like they give you instructions, and it's like you basically need some like explosives to get it open. The thing is like so well packed. It's like for the love of God. And I'm literally when I was talking with the CEO of the company, it was really funny. He was telling me, he's like, oh, the first one that arrived or whatever had problems or whatever, so they made it so perfect,
dude,
that you can't even get out of the box anymore.
The guy who delivered it, he apparently, I guess the deal is he has to be the one to unbox the first box. So it was like
see, you know those early on. I don't
those Russian dolls where there's one inside one. So he
oh yeah, those are
exactly.
You know, I had to hire a construction company.
So he literally came. He put it at the front of the office. It came in a big truck. Crack. He knocked out the first crate, and I was like, "Holy crap, there's more." He's like, "Yep, but I do this half. The rest is y'all." So we put it in the office. Then I cracked it open myself, and I saw it. And I mean, it's a heavy device, but what I love, it's a solid device. I mean, I like machinery or technology that has a good weight to it. Maybe that's my bias, but it makes it
feels like it's made.
Exactly.
Yeah, definitely.
It feels like it's built like a tank.
You do the classes, I do the classes. We put this thing in our car. We put it sideways. We move it around.
It's
and
literally
yeah. You know, it's like I'm hoping like maybe mine will break eventually, and then I can get another one.
There you go.
Or I can sell the company like mine broke, but guess it, the thing won't break. I mean, I think I could drop it like off a bridge. The thing's just not going to break.
It's just well
ridiculous. Yeah,
constructed.
Did you plug yours in immediately and start using it, or did it sit there for a while and you're like, it's so pretty, I'm not going to?
It sat there for about a week because obviously in the practice we're kind of moving things around, and I'm like, and I hadn't had my training yet. And I was like, but I'd watch all the school videos. I'm like, okay, you know what? So I did test it. So I put it on, make sure it came on. And yeah, so I had it and I had to plug it in to test it to make sure it could come on.
Right.
So it came on, and I was like, okay, good, everything's working. The screen looks beautiful. I put in the code. Okay, good. I remember I put on the head, made sure I did all the water stuff, fired off like 10 shockwaves, tack, and myself like, oh my God, yeah, it's loud, but okay, I see. Put it off, and I put it back in the corner.
Did you have any fear of it? Where you're like, ooh, I don't know it yet. I haven't had any training.
Not really.
Or were you kind of like, I play with everything, so I'm going to jump right into it?
Literally.
And as I know, Shockwave's like super safe, so it's not really going to be a problem. And I'm well educated to know not to turn it up or
exactly.
But
exactly.
You wanted to. So, who was the first person that you used it on?
You're looking at him. That's me. I'm like, you know what? If anything should be negative to happen, let it happen to me first, because then that way I can figure out what's going on. My knee.
Knee, and what's wrong with the knee?
Medial meniscal tear.
So you had a history, surgical or non-surgical?
No, non-surgical. This happened about almost 3 years ago.
What type of tear was it? Vertical, horizontal, oblique?
Vertical tear, but not all the way partial from skiing.
Excellent. So, I love skiing too, man. We got to go skiing.
I'm telling you, no, we ain't. That was my first.
I'm going to get you on ski boards and you are going skiing. Because guess what? With StemWave, we could get you back. Look, I had a hip replacement. I rehabbed my whole hip with this thing.
You are a
6
robot.
exercises.
You are a robot. Let me wait. Let me tell you something. Oh no, I love skiing. I loved it. You know, I hit a patches of really slick ice coming down, and it was like a green slope. It wasn't even like anything challenging. And then my right leg took off, my left leg tried to catch up, and then while I'm going down, I couldn't stop myself fast enough, and there's this, oh my God, this I would say older lady crossing my path, and I'm like, if I smack into her, one of us will die. Because I began to pick up speed, so I tried to ditch myself, and then my body went. My right leg said, "We're not going anywhere. We're going to stay up." And I heard the
And it's been bothering you ever since?
Well, here's the thing. It's got bad. Then I do regen med. I went to a conference a month later, got a shot, a stem cell shot. Was good for 18 months. Then my wife would tell you, my man brain kicked in because everything felt great. I was in the gym and we were doing box jumps. I don't know box jumps. Yeah. But there was a guy next to me, so we were paired up, and he must have been like in his early 20s. And he was box jumping like a fiend. And I'm with him. So I'm like, okay, I got to show up too. This is ridiculous. Exactly.
Right.
So I remember I did the first one. I was good. Second one, I was good. The third one, I landed kind of heavier on the right leg. I don't know what happened. And then I felt like a sharp, almost like a pinprick. I'm like, oh, crap. I got off the box. But you know what? I still had 5 more to do. So what I did as a guy, I kept going.
I've had experiences like that myself in the gym.
Then I went home, and my wife sees me limping into the house.
Got to get it done.
She sees me limping into the house.
Look, it was out the window.
She literally said,
my workout.
Yeah, she said,
I'm there with you.
What do you do? I'm like, what do you mean? You're limping. I'm like, oh, no. It's just a workout. Just a workout. She's like, what did you do? Oh, there was a box jump challenge thing. She's like, oh, God. I'm like, how's your knee? She's like, how's your knee? I'm like, well, it hurts a little. And then I was like, but it'll be fine. Then it just kept throbbing for like the rest of the week till the next week. And then obviously I began to do the pain meds and therapy.
The standard medicine.
Yeah, exactly. So I know exactly what it was. Exactly. And then luckily, like a couple of months later, it calmed down, but it always let me know it's still there. And this was like 3 months after I re-injured it, we got the StemWave.
And so you said that was the first.
Yep.
So how many treatments did you use on your knee?
For my knee, I must have done because I do like in packages of 10, but for myself, I did like 8.
Yeah.
Because I had a lot of other stuff I was doing anyways on the regen med side to myself in terms of like supplements and those things. And safe to say, beautiful.
And so the results you found it wasn't just knocking down the pain. You felt like it's resolved, right? So there was a finality, a final point.
Exactly. Range of motion is great. And there's no swelling. Everything is the way. Now, mind you, I'm careful now. So I'm not going to do certain things that are the bonehead things that are going to bring this back.
Yeah,
but functionality.
Exactly. And actually, because you know what? If we hurt ourselves again, we have a way to reduce. I keep telling myself that. I'm like, I can be a little more bold now.
Ice for this.
Because as far as I can reach it, I can get it. I'm still really worried about it. And that makes it nice.
Hold this right here.
Thank you. Great. So who was like do you remember the first patient you used this on? Not including yourself.
First patient, real patient.
Wait, you count as a real patient?
I do. You know what? Alan, you're right. I am a real patient. I have feelings too.
Doctor, heal thyself.
That's right.
You always have to take care of yourself first. And then you went to your first patient who was not you and.
Exactly. So with memorable patient, I can tell you is a nice lady of ours. She's in her mid-70s.
This wasn't the lady who has a ski slip that you missed.
Oh, no.
I just want to make
No, I lost sight of her. Thank God.
Could have been a little dangerous. Yeah.
So, but she was a patient of ours in our medical practice. And her main issue was bilateral adhesive capsulitis for 3 years.
Wow.
To the point where
you said 3 years, it doesn't go away.
No, she was like this. And she said, like, she would put her hands up to here. Now, when we saw her, they were already telling her, you need surgery. We need to go in and kind of clean out the shoulder to get you moving again. But she didn't want surgery because they even told her, which is right. I'm not sure how much improvement you're going to get, but we can try. She's like, she's not willing to try. So when I met with her to do the StemWave, I asked her, because what are you trying to accomplish with this technology? What do you want me to help you get to the most? She's like, I just want to put my hands up when I go through airport security. That's what she told me. I'm like, what do you mean? She's like, yeah, because when I go to airport security, they put me in that X-ray thing where it spins around, and I can't put my hands up, and the guy's yelling at me, "Ma'am, put your hands up," and I'm like, I can't. This is the most I can do.
Embarrassed.
So I know, but it was
like, or we call it like, we go through like activities of daily living.
Yeah.
Just the ability to do things that should be very like mundane and normal, like walking normally, putting your hands up, grabbing something.
Exactly.
How about grabbing a gallon of milk that you can't pick up anymore?
Or trying to reach into the kitchen cupboard. So for her, that was her why. And we did her, and I remember right after the first one, she was like, "Okay, this feels much better." She was happy, so she bought in. I would say by session 6, she went from being able to go here to here. I mean, and for her that was huge. She was just overjoyed, and we finally got up to as high as here. And she's like, "Yep, I'm never getting surgery."
And did you, when you were treating that area, was it more of the whole capsule of the shoulder? Yeah. So or identify individual muscles that are more involved? None of the chakras are going to penetrate.
Exactly. Right? So we kind of, since I had the MRI images, and even without it, on physical exam, I could tell exactly where her stuff was. So, I mean, like the MRI was a bonus. But I just kind of knew from her description. I'm like, yeah, that's what he said, adhesive capsulitis. I'm like, yeah. So I just kind of put her through some range of motion stuff, and she was able to get awesome results.
So I gave you like a ton of like self-confidence, like right off the bat. Yeah. Because remember, the wife is like, "Honey, you've wasted $500,000 on this equipment. You need to start getting results." Did you have this patient go to your wife and be like, "Your husband's onto something"?
Well,
or did you keep it secret because you're like,
"No, this was her patient. This is actually my wife's patient who came to get it from me."
To you, and she's like, "Gerald, you're the smartest man on the planet. I should never have doubted you."
I dream of that day, and it's never going to happen.
It's never going to happen, right? Yeah. But did you start getting more and more results, or she had to at least concede the fact that getting StemWave was a good idea? Did she ever get it in at all? Or did she just stay on that?
That's never going to happen.
Like, you find one patient out of 1,000 that doesn't get results, and she'll be like,
"I told you
it doesn't work."
You're married too, aren't you? Exactly. You're married too. You know it works.
Well, I hear this all the time. I know he's a medical doctor. Yeah, I am. Anything I do doesn't work. And of course,
it's not. But yeah, but
when they don't have problems, they get StemWave in the office, and she knows where to send them.
Exactly.
She knows
exactly.
She knows what to do.
It's great.
So what percentage of like patients are you using the StemWave with in terms of your regenerative like packages? Is it when you're doing the PRP, is using with all of them, or you still use it separately, or are you using out,
Mm-hmm. So it's based on the client. I try to add it on to everyone because I give them the protocol. Here's what I'm recommending based on what you have. So based on my evaluation, based on my physical exam, and obviously the history you give me, here's what I think will work best. These therapies in combo, and I think and most, if not 90+%, go for the combo. Very few decide to just do the stem cell injection, and I tell them, well, and I always you're gonna see results, but my goal is quality of life. And if I know that we can get a better quality of life plus results, obviously, by marrying the two modalities, why wouldn't you? And once they try out with the mapping session and they see the improvements, that's it.
We're seeing very few studies now, the PRP and the shockwave, which is really promising.
Because they both lower inflammation, which I think is a key.
What particular protocol? Sorry to interrupt you there. What particular protocol are you using? Like, there are different on that.
I've tried all different ways. So I've done it where we do the injection first, then a bunch of stem waves, or a bunch of stem waves, then the actual injection, and then the third one, which I think has shown biggest bang for buck, is stem wave for a couple sessions first, then we do the regenerative medicine procedure, and then we continue stem wave. And the idea, and it's not only been better for clients, but when you think about it, you're reducing the inflammation in that joint before you put in the good stuff, before you put in the cellular medicine targets that you're working with, whether it be PRP, PRF, stem cells, like whatever it is that you decide will work best for the client, you're putting that in there. You want to put it in an area where you already began to calm down the fire. So once that comes in, we calm down the fire more, and then you get more stem wave. So that way all the inflammation, or the majority of inflammation, begins to kind of subside significantly.
Is that the same case, like if it's like PRP in a hamstring?
Yes,
is it the same protocol? Or do you find that you don't need quite as many StemWave sessions in the muscle belly, let's say, or
in the soft tissue,
like joint, which is more
with an acute soft tissue injury, you don't need many. I mean, I had one young athlete. She was in her 20s, she was developing greater trochanteric pain syndrome, and literally the mapping did it. We mapped her. And I was like, you know what? Go home, see how you feel. Haven't seen her since. Her mom sees me for StemWave now for other issues. And I asked her mom, well, how's she doing? She's like, Doc, that one session, and she was great. I was like, so the mom is the one. The mom's older, so the mom has a few more joint stuff that I'm helping her to take care of. But the younger folks, yeah, you don't need much for soft tissue. You don't need many sessions for soft
And so for those who are listening who are not as familiar with the technology, you mentioned mapping a couple times.
Yes.
I assume that mapping, I mean, I know what it is.
Yeah.
Because I
So
teach it all.
basically, I like to say,
Yeah,
tell patients, it's my fact-finding mission. It's me going in to try to figure out where we need to be for this treatment. I know you came in and you said you had elbow pain. I know you came in and said you had shoulder pain. And I know what, if you have imaging, what the imaging shows. If you don't, that's okay. I know what your story is and your history is. And based on physical exam, okay, here's what we're dealing with. Let's put on the machine. And what I will do is I will go through a protocol and try to find areas, I like to call them hotspots, where I can hear the change, and the patient will audibly tell me, oh yeah, that feels a little bit more spicy, so to speak, because I hate the word pain. Pain's a negative word. So it's spicy, or it's a little bit more uncomfortable. I'm like, good. I think I know where we need to go in listening to you and listening to the machine. So it's almost like a group conversation when I'm in there.
That's like one of the things, like clinically I've seen also. It's like you have to have great diagnostic ability, which you obviously do. And you're using this really like high-end technology. And the technology itself isn't truly a diagnostic. It's a treatment modality, obviously. Yeah. But we have found ways to use the actual sound through acoustic deduction and using even a subjective component for the patient sensation to aid and direct the care. So we're not just randomly, like in a lot of the studies, they say, oh, we use a couple thousand chakras. They're just kind of rubbing it around. There's no specificity of care. They're moving it around. It's great that we can kind of harness the power of the stem wave and the shock waves and get it into the areas that we know the shockwaves need to go, so we can listen to the patient, which is great. But that's subjective. That's fine sometimes. Yeah. Or objective, which is sometimes better. Is just because it hurts here, it doesn't mean it's just there. It could be somewhere else. Sometimes it's a
combination of it too.
And that's like one thing that I know you love and I love with the education process with StemWave is we're always out there trying to take our providers and the people getting our technology and find ways for them to better diagnose, to integrate and work with other types of providers. So as a chiro, if I need someone if I have a patient who needs PRP, I got to work with a physician. I got to find someone to work with. And then if you need someone on the rehab side, sending out for physical therapy. Yeah. And so this allows us to kind of like network also and work with other providers. And it's not for you or me, it's for the patient's benefit. Exactly. And that's the whole altruistic side. So I always say StemWave doesn't like stand on its own. It doesn't stand on its own. It can. With pain and inflammation reduction and regeneration. However, we should never forget the skills that we have. You have a really impressive skill set. I'm in a different field. I have, I hope, a good skill set.
You do.
But what the StemWave does is it enhances what we're already doing. Exactly. So it makes us even better. And that's the whole thing about it. It's not just the shiny little object in the corner. It's we're using this in conjunction with everything else we're doing and the other people we're working with to really maximize those patient results. And I think that's what
did you just say in the corner? Listen, nobody puts baby in the corner. Okay?
No one puts that with it.
No one puts that in the corner. That's inappropriate. Come on.
This is awesome. I've loved this talk. Is there anything else you're going to add before we stop?
No, I mean, I think it's game-changing technology, and being early adopters, obviously there's a learning curve, but more people get on this, we're going to see healing across the board. And I just like I'm done with the whole tons of pills and tons of this and things that we know in medicine.
Just going to and injections, invasive versus. I mean, God, if you could do the same thing without
even surgery premature,
why not?
Premature surgery. Yeah. I mean, because I have some great surgeon friends. I know you do too. But my thing is, if let's see if the surgery is gonna be absolutely necessary after we give this a try. I'm not saying no. Let's give it a try. And if you notice that, okay, I'm actually moving better, okay, let's talk to the surgeon, tell them what we're doing. And if they say, oh, that's fine, give it a couple months and see how you do. I mean, now
that's a really good point, especially hearing it, from the medical side. Obviously, on my side, because we do a lot of rehab, we say that a lot. But surgery should always be the last thing that you do.
Yeah, of course,
not the first. And I think in this day of age, people just jump to the surgery, and you know what? As you know, sometimes the surgeries don't work as well as they should.
Sometimes,
right? StemWave is your absolute best way of dealing at regenerative medicine.
No, but if you are going to need surgery, let's face it. If you are going to need surgery for a degenerative process in a joint, why not? Why not give the surgeon a leg up? Meaning, all right, Dr. Ortho, you're gonna do a total knee. Here's what I'll do. I'm gonna work on the knee first. Slower the inflammation in that knee. All right. See if the patient actually needs it. If we lower the inflammation on that knee, the worst case scenario, right, is they still end up needing the surgery. But here's the best case scenario in that respect. I have already lowered the inflammatory drive in that knee. So your healing post-operatively is going to be much better. So you have to think
know
of
where I
it.
stand on post-surgical. I love it.
No, but
what
you,
is
you
your,
oh yeah.
I never actually
yeah.
asked you.
Oh, yeah.
Ian.
Oh yeah,
How do you
post-surgical.
feel about love the word.
Love it. Anything that's going to increase blood flow, reduce inflammation. I mean, you and I both know a scar forms because it's just disorganized tissue.
Yeah.
But if we allow the inflammation and the extra fluid to die down, or we make it die down by using modalities that we have, patients are going to heal faster, get up off the table, and be able to walk and live better lives.
Yeah, I like, I say this, and I'll say it again, and we keep saying it, that with post-surgical, especially in the athletic realm, or not even in the athletic realm, the ability to have an ACL graft heal in half the time enables the therapy component to begin much sooner. We are getting people better so much faster with this, but not giving up the PT or anything else. We're getting them through the PT faster.
Exactly.
Getting them through the other inches faster. So guess what? They get returned to sport. They can walk their dog faster. They're back in the gym faster.
Exactly.
It's great working with you on this. I love how you are integrative with everything on the medical side. It's music to my ears.
Appreciate what you do as well.
And I love the future we have together here at StemWave, helping doctors help their patients, because that's what it's all about.
One joint at a time.
Or one tissue at a time.
One inflamed tissue at a time.
Or one nerve at a time.
One inflamed body part at a time.
Or one scar at a time. All those tissues, we'll get them all.